Dr. Mondona is a board-certified internal medicine physician and certified menopause practitioner located in Ventura County, California. She has a passion for helping women navigate perimenopause, menopause, and midlife weight and hormonal changes. Thank you so much for joining us today, Dr. Mondona. She is joining us virtually because she is the mommy of 2 toddlers, and as a fellow mom, I get it, and I'm so glad you were able to carve out this time and join us today.
Thank
You for
you.
being
Thank
here.
you. It's awesome to be here, and thank you for accommodating me.
Of course. We are super excited about this conversation. So I feel like perimenopause, especially, but also menopause, has been such a trending topic lately. I'm seeing it everywhere. I'm also in the demo, I think, for the perimenopause. That's probably why. And I
Yeah.
think it's such an important discussion that previously we had no knowledge, like no awareness of it. We didn't know anything about it. And I'm so grateful for people like you who are bringing education and information. And so we want to dive in, I think, to that. Do you want to just briefly talk about what you do and how you kind of got here in this field?
Yeah. Yeah. My background is, I'm an internal medicine doctor, so I was in primary care for almost a decade, and it just really occurred to me there was such a gap in midlife care. There's essentially nothing, especially for perimenopause. Postmenopause, there is a little bit. Perimenopause, completely neglected, and it just was so heartbreaking. And I eventually broke off into my own practice where my entire focus is perimenopause and postmenopause and the weight management. But the majority of my practice is actually perimenopause. Like that group of women really has my heart.
What is the correlation between the weight management and the, I guess, hormones or hormone therapy?
Yeah, that's a good question. You usually notice the two kind of happening together, usually late 30s to 40s. There's something with the weight starting to accumulate around my waist, and then the hormonal changes could happen too. There's actually a biological reason for that. It is the changes in the hormones that are leading to more accumulation of the weight around the waist. So there is that biological connection there.
Oh, can you explain for us then briefly, like what is perimenopause, what is menopause, and what is postmenopause? Because I just learned
Yeah.
something very recently that I didn't know. I heard there was another podcast, and it was a roundtable of like women doctors, and I think they I think they came from different fields, but they talked a lot about this. And if I'm not mistaken, one of them said that menopause is actually one day, like it happens, and then you're postmenopause. Is that true?
Yeah, in a way,
Okay.
it is. So what they were probably referring to was your last menstrual cycle that you'll ever have. That is the point marking when you started menopause. However, you don't know if that period is going to be your last period. So the way it's actually diagnosed is retrospectively. So you go see your doctor, you say, "Hey, I haven't had a period in 2 years." Okay, you're postmenopausal. So it's defined as 1 year of no periods. Do you know if that period is going to be your last one? You don't. So that's why it's a retroactive kind of diagnosis.
Okay.
And
So
then,
interesting.
yeah, the perimenopause is a very wide range. Could start from 30s to 40s to early 50s. And that's the period of time where your hormones are fluctuating up and down more erratically than they were when you were before perimenopause. So it's kind of this erratic time of hormonal change. Postmenopause, everything kind of settles down, hormone levels stabilize or low, but they stabilize.
How do we know that we're having hormonal things going on inside of us? Like, how would one know that they're in perimenopause?
It's actually pretty hard to know. Sometimes you don't even realize. Even people in the medical field, myself, others don't even realize they're going through it. It just starts as subtle things, I would say, for some people, like mood, irritability. Maybe they're more depressed, maybe they're more anxious, they're kind of waking up at night more. The more obvious signs, I would say, are like, oh, I'm getting hot flashes. And, that one's kind of a classic symptom. But I would say probably the more subtle mood changes, weight gain, um, sleep disruption, things like that. So there's no defined way to say, okay, if you have this, this, and this, you're perimenopausal. That's why it's so important to go to somebody who understands it and they can put it together for you. So you go to your doctor and you say, listen, I'm having these symptoms. It's really the doctor that typically puts it together.
Yeah, that's what my mom was saying. I was asking her what I should ask you today, and she said that she
Yeah.
started having like just getting hot, and she was like, "Oh, maybe I just like slept with socks on or something." Like she didn't even realize that that's what was going
Yeah.
on until it had been a little
Yeah.
while.
Yes, it's really subtle. And with labs, it's fine to check labs, but your hormone levels typically come back looking normal when you're in perimenopause. And the reason is because a lot of the symptoms that people have in perimenopause are due to fluctuations in hormones, not necessarily low hormones. So when you get a lab, you're only capturing that one piece of data. You're not capturing the fluctuations of the hormones.
Would a strategy be to test more so that you kind of build a trend, or what is the like? What do we do?
Well, typically, what we do is, you don't even need lab work.
Okay.
Totally fine to have it. Totally, more data, not a problem. But usually, you don't even need the lab work to say, hey, I can start you on treatment for perimenopause. You could check it. With perimenopause, I would say if you look at your hormones, it's very, very erratic. So you get swings of highs and lows, up and down, up and down, up and down. So it's pretty hard to trend. There's no problem with that. But for me to treat you, I don't need the lab work to show me that.
And what is the treatment for perimenopause?
There's so many different treatments. Probably one really good way to treat the hormones is if you think, okay, a lot of the symptoms are coming because of erratic hormone fluctuations. How do we level that out? And that's best done through overriding the hormones through ovulation suppression. So, what that means in plain terms is birth control. That's why that's brought up a lot. There's nothing wrong with birth control. You'll commonly hear doctors recommend it to patients in perimenopause, but the reasoning is because that kind of shuts everything down. But the issue with birth control is it's very, very potent. The type of estrogen in there, a lot of women don't tolerate. I don't know if you guys have ever experienced, but some women don't feel good on birth control.
Yeah, I can vouch for that. I haven't
Yeah.
had birth control in I don't even know how long, over a decade, and the last one that I had was a what's the one they put inside of you?
IUD.
An IUD.
IUT, okay.
I thought I was losing my mind. I was struggling so much for like 6 months, and then finally it just
Aw.
occurred to me to even consider that, and I had them remove it, and I had completely balanced out, and I'd never gone on birth control since. Also
Yeah.
Yeah.
for other reasons, but that was
Yeah.
the last time.
Yeah, I'm
Yeah.
the same. I haven't been on it in like 10 years. I did it for 6 months and I gained like 20 pounds. My boobs got huge. I was like, I'm done with this.
And that's super, super common to hear from women is they had a bad experience. I'm not touching birth control again.
Yeah.
So that's the beauty of perimenopausal care. It's so individualized. There's many different hormones that we can use. And a lot of them are not as potent. They're not the synthetic kind of birth control, the ethylene estradiol that's in typical birth control. So there's different ways to manage the hormones, but I think most commonly when you go to the doctor, you'll probably be offered birth control for that reason of kind of controlling the erratic hormone changes. But that doesn't mean that you have to use something that you didn't feel good on.
Oh, sorry. Are there any
That's okay.
holistic ways to treat perimenopause?
Absolutely. So there's definitely a correlation with mood changes and hot flashes, certainly sleep disruption and weight. So that's huge. I actually had someone tell me, I think it was just this week, when she had lost weight, the hot flashes just dissipated. And so there's definitely a
Interesting.
correlation there. It's even in textbook about how if your weight is above, goal, you can have more hot flashes. So Absolutely, for everyone, I think the lifestyle, your nutrition, your exercise is of the utmost importance. You know, I would say even that if that's not in a good place, it's still pretty hard to get you feeling totally better with just medication.
Mm-hmm.
It's definitely a holistic approach to get you feeling the best you can.
I was going to ask you about the nutrition and if that mattered or if that altered it a lot.
Yeah.
And I was
Oh my
also going to ask
gosh.
you about, I grew up, my mom had, she's always told me that she had early menopause. I think hers came in her mid 40s, but she also has rheumatoid arthritis. She was also very stressed my entire life. And I
Oh.
didn't know, and so she kind of was always prepping me for an early menopause because she said, well, it usually is the same for like, you carry it from your mom, like whatever your mom had you
Yeah.
kind of go
Yeah.
through. So I've been preparing for that my whole life, but now that I'm older,
Oh.
now that I am really into nutrition and wellness, I just wonder how much of
Yeah.
that is biology and how much of it is lifestyle. Like she's fairly healthy, she's not
Yeah.
overweight or anything, but
Yeah.
she had a high stress marriage and she had 3 kids and they were running a business and
Yes.
there was
Yes.
all of that.
I definitely think your genetics are not your 100% your destination. So I think, altering your lifestyle, optimizing that, I think can change the path of like when you hit menopause. But we do ask patients for general guidelines. When did your mom go into menopause? That gives us some idea of when we think you could be. But do I think that's your ultimate destination? Absolutely not. It's so multifactorial that it's hard to say. It just kind of gives us a general guidance. You could enter menopause early, but absolutely, I think there's a role for stress and lifestyle affecting that timeline. Absolutely.
That's so interesting. What are the most, like, when people come to you, what are you getting asked the most frequently, or what stories are you hearing, or what challenges are you hearing the most?
Usually, when patients come to see me, it's because their doctor won't offer them treatment. It's at the point where they have all the symptoms. Since I'm very knowledgeable about perimenopause, I'm like, oh yes, your symptoms are clearly perimenopause, but they just can't get help from their doctor, and they love their doctor. I have so many of my patients who love their doctor, and this is just one aspect they cannot help them with. And so I would say I'm more of like a specialist kind of add-on to just, okay, let's help you through this. And you still have your regular doctor. So that's where I come in. But I think it's a combination of, doctors weren't really trained to treat perimenopause. And then they're also busy. Traditional, insurance-based care is a quick 15-minute visit.
Mm-hmm.
There's just not enough time to go through everything. So I think it's a little bit of that combination. And that's why I just have in my practice, like, time. I'm going to give you time, whatever time you need, that's what we're going to spend, because I really want my patients to feel better at the end of this process of working together. That's my goal, is just to have my patient feel better.
What are some myths of perimenopause and menopause?
There's a lot of different myths. There's a lot of fear-mongering myths and myths about when to start treatment. One I hear a lot is about periods and perimenopause. This is, I don't know if you guys have heard this, but you can't possibly be in perimenopause if your periods are normal.
Oh, interesting.
Have you heard that?
No, I haven't heard that. What is usually people expect to not to have irregular periods as an indication of perimenopause?
Correct. Yeah, so that's a huge one, because you absolutely can have other symptom changes before your period changes. So you don't need to have period changes in order to be in perimenopause. So that's a huge myth. Yeah, I hear that one a lot. Another one I get is, we can't really give you treatment until you no longer have periods. So once your periods stop, that's when I can give you treatment.
And you can get treatment before.
Yes.
And that's hormone therapy? Is that?
Yes.
Okay.
Absolutely. Yeah. So that one I hear pretty commonly. Yes. And maybe the big one, probably the elephant in the room, is hormones cause breast cancer. I'm sure you guys have heard that maybe.
No.
No, I haven't
No?
heard that.
Oh,
That's crazy.
no. Yeah. So with the big WHI scare that came out in the 90s, that's what got a lot of women off of their hormone therapy, and a lot of doctors to stop prescribing hormone therapy. Was they basically put these headlines out saying your hormone therapy from these studies is causing breast cancer. And so that's kind of always been in the atmosphere. And women are so scared now to use hormone therapy because of that, that headline, that association with breast cancer. So I would say that's probably one of the biggest myths. Hormones, the hormones, especially that we use today, estradiol, micronized progesterone, similar to what your body has, they do not cause hormones. Our own hormones are not causing us cancer. So that's a huge myth.
Where did that come from? And do you think that that maybe the hormones used before did contribute to that, and they have just evolved and become better, like a better quality and more closely related to what we already produce naturally, or what happened there? Like,
how did that? Yeah. So with the study that kind of induced this fear, they used different hormones than what we use today. So today we use, no, some people don't like the word bioidentical, but essentially what it means is we use hormones that look just like the hormones that we have in our own body. And so with this study that kind of had the scare, they used hormones that were completely different. And upon reevaluating the study, it seems to be that there's a synthetic progestogen that was used in the study that slightly increased the risk of breast cancer. It wasn't anything large, but it came from that type of progestogen that was used in the study. So that's where it came from, that slight increase, but it was a different hormone than we use today.
Okay, so that one doesn't get used at all today.
It does get used. It's not a bad hormone. It's just really not offered. I wouldn't say offered. It's not really the choice first line because I would say of that association. But there are some women who do well on it, actually.
And can you break down hormone therapy? Because I know it encapsulates a lot. Like, what is that? It's not just one thing, right?
Yeah. Hormone therapy, it can be used. It's a pretty broad term. I would say it's giving women back some of the hormones that may be low. So when you think about birth control, we're giving you a super high dose of hormones to shut down ovulation so you don't get pregnant. With hormone therapy, it's actually a much smaller dose. We're moving towards more of the terminology hormone therapy rather than hormone replacement therapy. But it's really just giving you back some hormone. And I would say it's a lower dose than, what you had before even.
What hormones normally need to be replaced? I don't know anything about this.
That's okay. There's the three big ones are estrogen, progesterone, and testosterone. So those are the ones we typically look at. How are your symptoms? Do we think your symptoms are from low estrogen, low progesterone, low testosterone? And we kind of base our treatment on your symptoms. So those are the three we typically look at.
So I had always thought that estrogen was for women, testosterone was for men, but you're now saying that we replace that. So we all have everything.
Yes,
men have estrogen too?
Yeah, we have all three.
Oh, yeah. And do men have all three? Does everyone have everything and we just have different levels? Or do women have everything and men just have testosterone?
Men do have estrogen, yes. And fat actually, like if somebody's overweight, can actually increase estrogen levels. But yes, we both do have estrogen and testosterone. Absolutely.
So we have different levels. Like men, they're more testosterone dominant, and we have. Oh, I didn't know
the
that.
levels. Yep. Yes.
I didn't know that either.
Okay.
I heard something that was like, wow, really put it into perspective. But I heard that men when you compare men to a postmenopausal woman, the man has more estrogen than the postmenopausal woman. And that always like stuck
Whoa.
with me. I'm like, yeah. I'm like, whoa, that's kind of wild. It's super interesting. I'm like, I never forgot that.
I read that in a dating book actually, like years ago. Yeah.
That men have more estrogen?
Yeah, like older women have more similar hormones to like younger men.
Wait, okay, so I have a friend and she's convinced that men have their own version of menopause. This is kind of off track because we're trying to keep this focus on women. But is there any truth to that? Because she was like, I swear, she's a little bit older and her husband is older. And she's like, I swear he's going through his own version of like whatever the guy menopause is what's happening.
I don't know. Is that like more of a midlife crisis?
That's what I called it. That's what I said. I was like, it sounds like a midlife crisis. But do we just call it a midlife crisis? And there's actually some fluctuations, like some chemical imbalances?
I'll have to look into that. I don't know. That's what I thought, but maybe they do.
Yeah, she swears there. She was like, I bet if someone looked into this, they would find out that they have their own like version of this.
That's interesting.
Yeah, I'll never say never. Never say never. It's possible. Yeah,
my mom had another question for you when I was talking to her this morning.
Yeah.
She said like she had really bad PMDD like all of her life with her periods, and she said she still feels the fluctuation even though she doesn't have a period anymore, that like every 28 days or whatever she's feeling very emotional and upset, and she was just wondering if that's something that's like always stays the same even though there's a lack of like a physical period now.
Yeah, I mean, physiologically, it should get better once the hormones are stable and low postmenopausally. But again, never say never. I mean, I would, you could almost trial out and see, does she do better with hormone therapy? I think that sometimes to answer some of these questions, we have to try out the hormones, and that'll give us our answer most of the time. If you're like, whoa, I'm so much better, then we have to wonder. But PMDD is, I actually did like really want to bring that up because for women that go through PMDD or postpartum depression or PMS, these women are at the highest risk of having depression during perimenopause. And so that is kind of one of my missions, is to help this population of women, because you don't know when you're in it, what's going on, what you're feeling is that sometimes. And it can get pretty dark. It can get pretty darn dark. So that group of women with the conditions, PMDD, PMS, postpartum depression, anxiety, they're at such a high risk for this during perimenopause. So I really try to help those women, The suicide rate for that group is high too. So it's really, really critical.
So for that group of women who are at higher risk of the depression and suicide, is it proactive of them to start hormonal therapy earlier on, like during perimenopause? Or is the hormonal therapy only recommended if you're having active symptoms?
I think it's important to plan almost for this. Even if you think you start to have the hint of the symptoms, let's get this figured out. Let's get your hormones regulated so you don't progress through this period of life. Especially if you're still having PMDD, PMS, you're actively having symptoms. So I think we should be more proactive about it, because once someone's in a really bad place, it's a lot to get things back to a better place. It takes a lot of time. It's a lot of emotional trauma. So yes, I'm very proactive about it. If you even have a hint of it, let's do something about it.
And is this in the same realm? Like, is there a connection between, I know that there's a connection between hormones and things like PCOS and endometriosis. My sister-in-law just had a hysterectomy, and my mentor both had a hysterectomy. One had, I think my sister-in-law, they're still trying to figure out what exactly she has, and she's waiting to get some labs done. But
Yeah.
the mentor, she had everything. It said there was polyps, there was cysts, there was, I think, endometriosis and something else I'm forgetting. But
Yeah.
how does this all relate to one another? Is it related? Is that a separate thing, or is that
Yeah.
all still hormonal?
Yeah, I think hormones drive a big part of this. I mean, for things like endometriosis and fibroids, those are more estrogen driven.
Okay.
And so typically for women who go through perimenopause, we actually see a surplus of estrogen during that time. So you can have those symptoms start to worsen, endometriosis, fibroids start to grow during perimenopause. So there is it's definitely hormonally driven, I would say. And because of the estrogen being more predominant during perimenopause with those spikes, yes, it can definitely get worse during that time.
What about if you get to the point where you do have the hysterectomy,
Yeah.
what is the best approach afterward in terms of hormonal therapy? Like what does that look like? Does it change the path?
Yeah, that's a really great question. So for our younger women, 40s, certainly 30s, you're actually doing more harm to the woman if you don't give her hormone therapy after a hysterectomy. And when we're referring to a hysterectomy, in this case, we're referring to ovaries are gone. So the hormone production is gone. So if that woman doesn't get her hormones back, her risk of heart disease, bone disease, brain changes, all of that goes up. So it's more harm to not give her hormones than it is to give her hormones.
Is it common, like, are doctors doing that, or do they have to really advocate for themselves and ask for that?
Ooh, I've seen it both ways. I think more and more the knowledge and the information is getting out that we need to treat our young women right away, and usually with higher doses of hormones to prevent, heart disease and dementia and osteoporosis. But will I say it's across the board? No, because I've actually seen it where patients have come to me and they've been off of hormone therapy since their procedure, and so that opportunity was missed. So I'm hoping it's getting better, but things are definitely not 100% yet.
Yeah, so it's definitely important to push for it if you have a procedure, if it's not
Yes.
being offered.
Yes,
Ask for it.
absolutely. Have a plan for after if you're going to get your ovaries out. Yes, 100%.
Is hormone therapy forever? Is it something you do for the rest of your life?
Absolutely, it can be. There's a few contraindications that may change the course of treatment, like God forbid somebody develops breast cancer, and they need to come off of their hormones, or they have a stroke or a heart attack. There are a few contraindications where we're like, okay, here the risk is outweighing the benefit. We need to take you off for this time. But that's only a few situations. But for everyone else, I think the majority of women could stay on indefinitely.
What do we need to know as it relates to hormones and sex or sexual health? Is there a correlation, and what should we know?
Oh, 100%. So a lot of women also will notice libido changes when their hormones are going through these erratic changes of perimenopause. If you don't feel good and your mood is thrown off by these fluctuations of hormones, you're not interested in having sex. I mean, on top of that, you get lows of estrogen during these fluctuations. That leads to vaginal dryness, vaginal pain. If you're having pain, you're not going to want to have sex. So 100%, these two things go hand in hand. And I would say there's even less treatment offered for these women who go through libido changes.
Do you use
So
the
it's
GLP-1s often to treat the weight management aspect of the hormones?
Yes, it's actually my favorite weight loss medication to use. I still emphasize the lifestyle aspect,
Mm-hmm.
which is really the pushing higher protein, doing strength training to gain muscle.
Mm-hmm.
But the GLP-1s have been the most life-changing medications I've seen for weight since I mean, I know I'm a younger doctor, but I've tried other weight loss medications with patients, and nothing compares to the GLP-1s. They're just they're just amazing.
And you consider them fairly safe?
Yeah, that's part of the reason I do love them is their side effect profile is so low compared to the other weight loss medications. Like there's one medication called phentermine that some patients will take for weight loss. It's a stimulant, but most of my patients have had side effects on it. And so it's just not a tolerable medication. But with the GLP-1s, no, I mean, the most I see typically is some constipation and nausea, and that's about it.
What about infertility? Is there discussion around that and hormones? Is that usually a factor?
Yeah, I mean, I don't specialize in fertility, but 100% hormones do play a role there. Yeah, absolutely. It's not my, I don't focus on that, so I don't want to speak too much on what
Yeah.
I don't know in that world.
What can younger people do to set themselves up to have an easier time in perimenopause?
So I think I'm a planner. I think just kind of knowing yourself, knowing your risk factors, like I mentioned, like the PMDD, PMS, things like that, kind of being aware of what to look for early on, I think just prepares you. And then if you feel like you're having the symptoms, going to somebody knowledgeable and discussing them to see whether this is the hormonal change. Um, just being prepared with the knowledge. And so that's why I really try to educate women on like, this is what perimenopause looks like, and this is what you can expect, and your labs are going to be said they're normal. So I really try to educate women. I think just that's empowering just to know when you get to that point, because we all go through it unless you have surgical menopause, which is, removing your ovaries. You're all of us are going to go through it. Just being prepared for what to expect.
What's something that you wish all women knew about perimenopause?
Ooh, I wish so many things. I wish, you know, it was understood that this does happen. It's a biological change. The symptoms, the mood changes, the sleep disruption, it's not because you're not doing enough. Maybe your life is too stressful. There's actually a biological change. And I think that's so important because I feel like sometimes the woman gets blamed, like, maybe you need to like do a less stressful job or something. No, there's like a biological change here happening. So I think that's important. Validating there's a real reason this is happening.
Mm-hmm.
And number two is how to get treatment. If you go to, your doctor and they get lab work for you and they tell you everything is fine, that's that's expected, but we still can give you treatment, and we should offer you treatment still. So I think just being able to go to a knowledgeable provider to actually help you. Those are two things that I would hope for.
What are the benefits of strength training? Because I do hear that a lot right now in regard to this topic. So, what is it about strength training that's
I
helping us?
mean, if I were to call anything what is it, like the fountain of youth, the secret of youth, it's strength training 100%. Like, if you do nothing else in your life, do that, because muscle is a longevity organ. It does so many things for us. It protects us metabolically, it helps our metabolism, it keeps us strong, prevents us from falling, breaking our hip. I mean, having more of a debilitated, immobile later life, I would say to me, that's the most important thing if you do nothing else. Do the strength training, get strong, because it will preserve the quality of your life and prolong it. Absolutely.
How often should we be training?
I don't think there's any like specific ideal number because some of my patients, I tell if you can only do one time a week, let's do that.
Yeah.
Because I would rather you do that than be so overwhelmed you don't do it at all. So I just work with the person. Like I'd rather you just do it once a week than none at all. I personally do it 4 times a week. I find more than that, my muscles get too sore. I'm burnt out. So I think everyone's a little bit different. You kind of just find what works for you. But it could be one time a week. It could be 5, 6 times a week.
And do you have a favorite method or style of strength training?
I'm pretty boring when it comes to it. I do have a trainer that I work with, but basically we have a set of movements, maybe 4 movements that we do, that I have planned out per day. And I do those same 4 movements every week. And I just work to push the number on how much I'm lifting. So it's pretty boring. My goal is just to be able to do either more volume or more weight. I don't think, it's not 100% like everyone's right way of doing it. For my goals, that's kind of just where I'm at.
I love that. That's helpful to know.
Yeah.
Yeah.
Is it important to train until failure?
I think it also depends on what your goals are. I think if you're really pushing growth, yes. But this is even for myself where I try to be very precautious. I also weigh out getting stronger in a sense to injury, because I also don't want to injure myself and then be put out for a while. So I do it to a level that I'm comfortable with. And I think that's what everyone should do it. Like if you're constantly getting injured because you're pushing to failure, that's working against you. So I think you just do it to a level where you're comfortable, you're not constantly getting injured.
That makes sense. I wanted to ask you about your personal journey here. How did you get into this? What made you kind of focus and specialize in this, in perimenopause and menopause? And who did you have to become to achieve what you've achieved?
There's like this saying, like, the versions of you had to exist to get to be who you are today, something along those lines. And it's so true. Like, so my childhood, I was very overweight. And so you go to the doctor and they tell you to eat less, exercise more. I think, the millennial generation, we were told to just do cardio, and don't eat anything. And so what did that lead to? It led to an eating disorder. So I developed a severe eating disorder to the point that I was way underweight. I wouldn't eat. It nearly killed me. So I went from one extreme to the other. I had zero guidance on like, is there a healthy way to do this? I was just told to just eat less, right? So that's what I did. So I had to figure out for myself through college how to get healthier. And I went through the strength training journey. I worked to get stronger, to increase my food intake because I was essentially eating nothing. So I had to figure that all on my own with some online resources, but I eventually did it. I think I came out of that eating disorder and I feel so much happier now. So that was one thing with the weight that I really wanted to incorporate into my practice, because believe it or not, there's still doctors telling our patients to eat less and exercise more. And all you're going to do is create an eating disorder. And so that to me is a huge mission. I actually usually want my patients to eat more than they are, because a lot of them are not eating very much and their metabolisms are so low. So that's what led me to the weight aspect. And then for the hormonal aspect, I would say, with pregnancy, going through my postpartum period was one of the darkest times of my life. And I remember at that time, I didn't understand what was happening. I just knew like, I just wasn't myself. Like I didn't want to like be around like what was going on. It was just dark. And later, I think somebody told me, they're like, do you have like postpartum depression? I'm like, I'm sorry, what? Like, it didn't even like occur to me what was going on. So that was the first time I realized the power of what these hormonal changes can do. And then I think the other piece of that was that once I got through postpartum, I started to develop essentially PMDD, where every cycle I was going through doomsday, and my anxiety was driven up, my depression. So like half of the month I was extraordinarily depressed, and I'm like, I know this is hormonal 100% because it's very cyclical. I can tell you the week before my period, I feel like I'm gonna like something's gonna happen to me. I'm like, it's like doomsday. And so I got treatment from there with hormones, but it really was life-changing. I think for me, like seeing the difference coming out of that dark place to like what these treatments can do, that was life changing for me. And I was like, okay, so other people are going through this too. And so I have to help them. I don't want any more people to have eating disorders if they don't have to have them. I mean, why? And then that dark place with these mood changes with hormones, I don't want women to go through that. So that's my two biggest, what I work on the most with patients.
Do you feel like you were supported in your own personal journey to healing? Because I know you said you had to find out a lot of it kind of on your own, and I'm assuming through trial and error, and you're a doctor,
Yeah.
so you had a lot more access to information.
I don't, it's not that, I don't know. I would say I was kind of ashamed in a way to be going through what I was going through. And I think I just didn't bring it up. When I realized what was going on, I kind of started to look into what could help me. So I put that on myself. I didn't really seek treatment. I was so ashamed, like, what is wrong with me? And so maybe that's more of my personality. But I think I think another part of this is, I don't know what you guys think, but I think postpartum depression and things like that are just not talked about.
Yeah.
100%.
Because yeah, I mean, I'm a physician and I didn't even know what was happening to me. And then somebody told me, and I put two and two together at that point. But that was a huge thing that, like, why is this not talked about?
I love that you're bringing awareness to it, because I agree with you. I think so much of it is that we just suffer in silence. We think we're the only ones, and so we don't talk about it. So I think just you sharing it is going to empower and help a lot of women to speak up. And similarly, I also went through postpartum depression. I didn't know that's what I was going through. I went to therapy 2 years later. She was already 2, and I still was just not myself and really struggling and not in a good place mentally. So I went to therapy, and that's when I learned that I had postpartum depression. But same thing, I didn't even know, even though I had heard that term, when I was in it, I wasn't thinking, oh, this is postpartum depression. I just was struggling.
Yeah.
It's wild, and it's a very vulnerable time. And so not to be alarming, but those periods of times give us a little preview about what perimenopause could look like for us, for people who go through, we're more sensitive to a hormonal shift. So that means that we could be in that similar situation during perimenopause. So that's why I really try to empower women to let's figure this out, because you don't want to go back to that place. It's a really dark place.
Yeah, it is. I'm glad that you mentioned the shame part, because I think that is a huge one we do. I know I did. I had a lot of shame, which prevents us from seeking help oftentimes for too long.
It's so sad. And, people expect you to be happy because you have a newborn, a baby, and yes, it's happiness, but it's more than that. It's not in our control. There's a hormonal change that really is affecting our mood. And so, yes, I think there generally should be more awareness about that. It should be acceptable to talk about, but it's not, because, you think if I say I'm depressed, I just had a baby, people are going to think you're ungrateful. So, or you're not a good mother. So yeah, that really pushed me into really helping women through these mood changes with hormones. They all overlap.
It must give people a lot of relief to know that this is just a hormonal thing and not some flaw, that it's totally normal.
Yes, 100%. I wish somebody had told me that. When I was going through postpartum, I just thought there was something wrong. I'm just unhappy. Not that there could be a hormonal component. So if somebody had told me, listen, there's a reason you feel this bad, because you don't have, your hormone levels are low, there's fluctuations. I would have been so relieved, but I never heard that. So yeah, I do try to validate all my patients and first tell them listen, you're going through a lot, but I just want you to understand that there's a biological change, that this is why you're feeling this way. So let's take that off of your shoulders. Let's just take that weight off your shoulders. This is not you being difficult. This is a biological change.
And for someone that's going through postpartum depression, once we have the awareness and we have the shame removed and we're ready to get help for it, is it going to be similar, like that hormone therapy can help with that? There's treatment for it, or is it more support, like therapy?
I would say every individual is different. I think it gets a little bit trickier because most women are nursing. So it's really just individualized care. Some women do better with just therapy. Some women do better with medication. SSRIs, antidepressants are commonly given. I think it just varies woman to woman. I think some women just really need that validation and support.
Yeah.
Mm-hmm. I think that would help so many women just go through it. But yes, there are treatments 100% that can help with postpartum. And I think just having women feel comfortable breaking it up would help so much.
I agree. Is there anything that we didn't ask yet that maybe we just aren't aware of and that you think is really important for women to know?
I think I hit the things that I felt were like, oh, I need the world to hear this. But I think those are like my big things that we mentioned. Maybe the one other thing I would mention is with weight, just touching on that a little bit. That's another thing where I think the patient needs to stop being blamed for. It's not the patient not doing enough, that they're not losing weight. There's also a change in your hormone responsiveness that causes you to hold on to weight. So the same thing there, we need to take that burden off of the patient and not allow them to feel ashamed for needing or wanting treatment. I mean, we don't do this for any other field of medicine. We don't make you feel ashamed for needing blood pressure medicine or our diabetes medication. But with weight, there's still that association with shame, and that needs to stop.
Yeah, that's beautiful.
And I'm glad that you said that.
Yeah. So.
Oh, it's been an honor talking to you. Thank you again so much for carving out time today. We know that you're busy and need to get back to mommy duties and work and everything, but we're so glad that you were able to join today. Thank you.
Thank you for having me.
And also, where can people find you?
You can find me on Cyra Wellness, CYRA Wellness, or just look up Dr. Mondona Goodwin and you'll find my practice.
Amazing, and we'll make sure to add that in the notes too.
Yes.
Thank you, Dr. Mondona.
Thank you so much.
Thank you. Nice to talk to you guys.
Bye.
Bye.